Hi there, my name is Chui, and this is a recording of a talk I gave on the subject of joy in work at our medical imaging department in March 2020. So, over the next 25 minutes or so, I'd like to give this presentation about the subject of joy in work. And the way I'm going to this talk is first of all, I'm going to talk about the argument for joy in work. Then spend a little bit of time about what organizational science has to say about the factors that contribute to joy in work. And finally, a little bit about our project, which we are planning to initiate in our medical imaging department from this point forward. But before I dive into that, I'd just like to show you a still photograph from a movie that you may have seen recently in the cinema called 1917, and it was set in the First World War. And I'm going to ask you to take a look at this image here, and just going to have a look in a little bit more detail. So these guys down here on the left-hand side, look at these guys. They're hunkered down, clearly fearful. Seems to be chaos around them. Not sure what's coming next. And this guy here, who's in the foreground on the right, is he their leader? Well, maybe. He's waving his gun around and looks pretty angry. Is he giving orders? Maybe. Does he know what's really going on? Well, maybe not. And then these guys in the background there, at the top of the trench. Look at these guys. So what are they trying to do? Well, maybe they're trying to see what's coming next. Maybe they're looking to see what's coming down the pipeline, what more they have to face. Overall, it's a picture of chaos. All of them taking cover, not sure what's going on around them, and all of them just trying to survive one more day. Now, given that description, does this sound familiar to us? Does this ever sound like a day at work for you? Well, of course, our daily work doesn't compare with the horrors of war, and yet we find ourselves at work borrowing much of the same terminology, don't we? We might say that we're hunkered down, dug in the trenches, grinding it out, hanging on for dear life. We might say all hands on deck or action stations. We might even describe ourselves as just trying to survive one more day, or another week, or another year. Sometimes we might even describe our workplace as a bit of a war zone. Now, studies indicate that war takes a psychological toll on its participants. Approximately 15 to 20% of soldiers returning from active duty during the Iraq War developed PTSD, or post-traumatic stress disorder, and some estimates have it at 30% following the Vietnam War. Now, we don't suffer this level of stress at work to develop PTSD, but we can experience negative psychological fallout from our work, and we call that burnout. But what do we mean by the term burnout? Well, burnout is a result of prolonged periods of stress and manifests in certain ways, and they can be characterized by this list here. So some of the symptoms of burnout we see are low motivation, so people don't actually want to do the work. Low engagement, they don't wish to get involved in improving or changing their work environment for the better. They often produce low quality work because they're often just trying to do the very minimum that they can get away with, just trying to survive. There are certainly increased errors when people are burned out, and that's related to the lower quality work. And of course, more sick days, and in the medium term, a higher staff turnover. And individuals may manifest this differently. Some personalities may shut down and become very quiet when they're burned out. Others might become angry. Anger directed at their bosses, at their colleagues, at the organization, at the system as a whole. Others might become cynical, and generally there's often a feeling of helplessness, generalized helplessness. All in all, people dread coming to work when they're burned out. So what is joy in work? Well, in some ways, joy in work can be described as not simply the absence of burnout, in the same way that health is much more than simply the absence of sickness, but in much more positive terms. So, um, people who can find joy in their work might feel satisfied with their work and their workplace. They might feel pride in their workmanship and the job that they're doing. And they would look forward to coming to work, um, enjoying their work. And when we see joy in work, when we see departments that have joy in the workplace, are opposite to those which are characterized by burnout. So now we have very high motivation. People really want to do the work. High engagement. People are looking at ways to improve their work, to improve their work for both their clients and themselves. They produce very high quality work because they're willing to go above and beyond their described duties. And we see decreased errors, and this is quite an important piece. We're not quite sure exactly how it translates joy in the workplace to decrease errors, but it's clearly demonstrated again and again that the error rate goes down. And there are less sick days and a much higher staff retention in the medium term. And more than that, actually, joyful workplaces actually act as a recruitment tool, in that people want to work, want to come and work in places which they see are joyful and which their staff clearly demonstrate joy in work. So, long story short, people actually enjoy being at work. Or, in other words, they are thriving and not just surviving. So what does the science say about how we achieve joy in work? Well, organizational science actually provides us with a large number of clues. And there are, in fact, multiple factors that have clearly been shown to contribute to a joyful workplace. And I'm just going to go through some of those which I've selected here. So the first is physical and psychological safety. So what does this mean? Well, physical safety is perhaps quite straightforward. It's freedom in the workplace, freedom from risk of accident or injury, but it could also mean freedom from fatigue, for example. Psychological safety, however, is a little different, and it implies a feeling of security, emotional security. It might be easier to describe as if I define the opposite of that, which is a psychologically unsafe workplace. So, a psychologically unsafe workplace would be characterized by a culture of fear, avoidance, generalized anxiety in its workers. People are constantly fearful about perhaps making mistakes. People are afraid to speak up or to call out bad practice, perhaps to advocate for their clients or patients, and to advocate for quality. So, in a psychologically unsafe place, people are not willing to do these things. Whereas a psychologically safe environment is exactly the opposite. So there's no fear, no bullying, less anxiety. People are open about making mistakes if they're able to learn from them. People are willing to call out bad practice and advocate for their clients and improve quality. The second factor is that contributes to joy in work is to be able to appreciate meaning and purpose at work. It turns out that being connected to a greater purpose at work is fundamental to a joyful workplace. Now, you wouldn't think this would be a problem working in the healthcare sector. But in fact, you'd be wrong. It turns out that we are so busy concentrating on what we have to do minute to minute, day by day, that we often forget why we actually do it in the first place. Now, others who work outside of the healthcare sector, interestingly, if you ask them, they would actually give an arm and a leg for the noble purpose of our work, which is essentially healing the sick and relieving suffering. So we forget that the patient is actually why we're here in the first place. Another factor is that we often depersonalize what we call our work. So in the imaging department, we talk about getting over the hip in a merge. Well, it's not a hip, is it? It would be odd if a porter brought a bare hip bone over on a stretcher from the emergency department. It's not a hip, but it might be a grandmother who slipped on her wet kitchen floor last night and spent all night on that cold floor and now has pneumonia. Um, we talk about the 10 o'clock chest with contrast. Well, it's not a chest, but it could be a lifelong city resident who's coughed up some blood earlier this week and is now terrified that he has cancer. If we concentrate on why we do what we do, then it turns out what we do will seem so much easier, so much more worthwhile, and we just rediscover our value and we feel like we're making a difference. The third point is having autonomy at work. And this essentially means having a degree of choice and control over how we spend our time and how we do our work. It turns out that being told exactly what to do and having no individual control whatsoever over how we do it is perhaps the single most demotivating factor in any workplace. And we're vulnerable in medical imaging because the demand for our services is seemingly relentless and out of our control. But there are, in fact, ways in which we can wrestle back, even in very small ways, how we organize our time, how we can respond to fluctuating periods of demand and work intensity. And on this topic, it raises the issue of participatory management. So, what's that? Well, again, being told what to do through a one way conversation from our leaders and our bosses is actually quite demotivating. But being given an opportunity to have a say, suggest ideas, exercise curiosity, maybe try something new without fear of punishment, and participate in decision making, even in a small way, this massively improves our feeling of autonomy and control. Factor number four, experiencing camaraderie with others. So, this is essentially about community in the workplace. If we have a shared understanding of who we are as individuals, what's important to us, what's going on with our lives, this builds a sense of community. Feeling united by working towards common goals in the department, for example, being able to ask advice and not worrying if we sound dumb for doing so, builds community. Offering each other psychological support, appreciating each other and feeling appreciated builds community. And being able to trust each other that they have our backs when things get tough or go south, and to let others know that we have theirs also builds community. Number five, perceive work life to be fair and equitable. Now, this is quite a big one. We all intrinsically crave to be treated fairly and equally, but deep down we know, and particularly if you have children, you'll know this. Fairness and equality is actually much more difficult to deliver than we think. It's difficult to treat your kids fairly when they have different ages, levels of maturity, different physical and psychological needs. And if we struggle to do this with our nuclear family of four or whatever, how much more difficult is it when we have a whole department of maybe 10, maybe 100 staff? We have managers who are trying to meet targets. We have physicians, unions, all of which have competing priorities. So deep down, we know it's difficult to achieve. And this raises the issue of the difference between equality and equitableness. Equality implies some sort of accurate measurement and balance of one versus the other. And this is extremely difficult to achieve. Whereas equitableness actually implies a degree of reasonableness. And this is something that we actually understand. And that's, in fact, what we're hoping to achieve much of the time and want to see in our working lives. Um, Deep down, we know it's difficult to achieve equality, but we'll settle for equitableness, for reasonableness. And so, what we want is simply often to have our voices heard, for our leaders to listen to us, to take our concerns on board, and really to just do their best with that information, and then to share with us how their decisions, were made. In summary, um, the factors again underpinning them all is the idea of physical and psychological safety, and we need that as the foundation for joy in work. And then we can work towards increasing our autonomy at work, increasing our mastery of our craft, working towards that mastery, and also working towards a purpose. Um, that meaning and purpose in our department, and then that in itself, as we work towards these things, will generate the camaraderie, that sense of community within our department. Okay, gears a little bit now and talk about the project we're hoping to do in our department to improve joy in work. And the project that we're hoping to do is across the whole imaging department over the next 9 months or so, hopefully accumulating with the end of year Christmas party. That would be a good way to finish, I think. And the aim is to improve joint work across the department, all work areas, including clerical and all the different modalities. Um, but keeping it to the imaging department over the course of 9 months, the scope is limited to the X-ray department, medical imaging, and doesn't involve, for example, the OR or the CAST clinic. We're just keeping it within our department. And then the approach we're going to use, we're going to adopt a methodology which is promoted by the Institute of Health Improvement, called the Model of Improvement. And this is a very simple, very powerful way, methodology for improvement, and it's quite easy to understand and implement. Um, it asks three questions. And the first is, what are we trying to accomplish? Well, in this case, we're aiming to improve join work across the entire department in all areas over the course of 9 months. Now, how will we know if a change is an improvement? Is the second piece, and that implies that we're able to measure what we're trying to accomplish. And so there are, in fact, ways to measure people's join work. We can do this through staff surveys. We can do this um, simply by asking people, how was your day at work? We can get them to tell us how their day was using a simple two-color bead system. At the end of the day, when you walk out, if you had a good day, you put an orange bead in the jar. If you had a bad day, you put a blue bead in the jar, and we can count up all the different colored beads and work out whether the department had a good or bad day. And that's another way of very simply measuring whether we're accomplishing our goal or not. And thirdly, what changes can we make that will result in improvement? And so this model, in many ways, works on the premise that lots of small changes will add up to major change overall. And the engine of this change, this improvement, is something called the PDSA cycle, which stands for Plan, Do, Study, Act. And these are essentially mini experiments. So we essentially give them the freedom to just try things out. To we see an area which might be a target for improvement. We'll plan to institute a change. We'll try it out, and then we'll look at that to see whether there was in fact an improvement or not. And if there was, then maybe we can expand that change on a larger scale, maybe roll it out more broadly. But if there was no improvement, then we would stop there and then maybe try something a little different. So, for example, you might have an idea about preventing fatigue. for long techs standing for long hours in the OR with the C arm, for example. So you could maybe plan to say make sure that there's always a portable stool available for the technologist in the OR. And you would obtain a stool, and you would make sure that it was always kept with the C arm, and the techs would use that, and then we could survey them. We could ask them, well, did this improve your fatigue? Um, and if there was a positive improvement, then yes, we can make it a fixture, a firm, permanent change to techs going to the OR with the C arm. And that's just one type of mini experiment in which is can be achieved through this model for improvement. But perhaps as I'm getting towards the end of my talk, you're wondering what can we do? What can I do at this point in time, as before the project even starts? Well, I think there are some things we can do, and I think we need to start having some frank conversations with each other and with our leaders. We need to start thinking about, well, do we have an issue with drawing work in our department, and if so, which areas, and what those issues may take, particularly thinking along the lines of the different factors that I mentioned a bit earlier. We need to start having those frank and crucial conversations. Then we need to identify what areas are really getting in the way and preventing us from developing and having joy in work. And they might be very small things, things that are really frustrating, things that just bug us every time it happens. Or it may be larger scale things, but we just need to identify these, because the next step then is to run these change experiments and to design the change experiments, to try them out, maybe on a very limited scale to begin with, maybe just with one patient. And then if it seems to work, maybe roll it out to 2 or 4 or 8, a whole morning or then a whole week. But just start on a small scale, and then build up from there. Try lots of different things, see if any of them work. But again, always check to see whether there is an improvement or not. Check the measurement, study the effect, and keep the positive and throw out the negative. So from my point of view, I am putting at this point, I'm putting a project team together to help me with this project, because I actually need about 6 to 8 people from the department, hopefully from all work areas in the department, to help me run this project, collect the metrics, keep track of the changes, evaluate progress, and encourage others around them to participate in all the work areas. And now, unfortunately, I don't have any additional funding for backfill, for example, for this. But I'm hoping that if we are successful, that we would. This is a good project. So if we are successful, I'm hoping that we would have the opportunity to present this, maybe to produce some posters, or even publish. Maybe present the project at internal and external forums and conferences. And if that would be of interest to you, then that might be a reason for you to sign up for the project team. On the other hand, you may just feel this is worthwhile, and this is something that we need in our department, and you're willing to give your time and effort, and join the team. Either way, I've left a sheet by the door, and I hope that people will be willing to sign up. Now, this recording was taken after the meeting, in fact, and I was actually very pleased to announce that, in fact, we did get more than 8 people sign up for the project team, which I was very pleased about, and that means that it looks very positive going forward. So I'm hoping that I've given you a little taste of what's possible, and where we hope to be going with this project. I'm hoping that we will actually improve our drawing work in our department, and then if we are successful, we'll all be as happy as alpacas, which, if you're wondering what a happy alpaca looks like, picture. Um, anyway, I'll leave that with you, and I'll take any questions afterwards. Thank you very much for your time and attention.